Blackrock Clinic is a 168-bed acute hospital spread over 5 floors. We have 8 operating theatres. We carry out surgery in orthopaedics, cardiac surgery and general surgery. Our intensive care is a new state-of-the-art facility with 12 beds and 2 isolation rooms. At present in Blackrock Clinic we have a number of opportunities for nursing staff who may be considering working in Dublin, Ireland, returning or visiting for the first time. We are also looking for staff who have experience in high dependency or critical care in the general ward, and we will certainly support them if they have an interest in working in this area.
Our vision is clinical excellence, personal care, and this is emphasised from day one when you join this hospital. We are looking for staff or nurses who will, I suppose, embrace these values and understand what they mean in terms of the patient experience here in Blackrock Clinic.
I started here 9 months ago, and before I started I didn't have any intensive care unit experience at all. So my background was orthopaedics and I came here from that. So I spent a bit of time with the clinical nurse specialist when I started here, Helen, and she just trained me in completely on everything, you know, ICU related.
I've been with Blackrock in intensive care for over 20 years, and so I've evolved with it. The hospital itself has, over the years as I've been here, has built to double its capacity. It's a hospital that is ever expanding, and you know, I'm proud to say that I work here now.
So everything was very interesting. You know, I got training from ventilators to dialysis, nitric oxide, everything like that. So it was all very engaging and interesting to start out with, and even now, still every day, I'm learning something new.
I think for anybody moving, there's always something to learn. We have all the latest equipment, we dialyse patients, we use nitric oxide. These are kind of things that maybe people mightn't have used before. So I think there'll always be something to learn. We do a lot of education in services internally. We encourage, you know, staff to go and do their higher diploma in critical care, and they're very well supported in that.
The nursing staff work in a very collaborative way with the surgeons and the physiotherapists, occupational therapists and social workers.
While you work sort of independently, like with one-to-one care with your patient, you're also having communication with all the other staff members, from nurses, carers, the doctors, anaesthetists, consultants. Everyone has a contribution to that one person's care. Although you're the one at the bedside 24 hours a day, nearly everyone has an input into how you're going to care for that person, I suppose.
As a nurse, what I felt here is you're heard and accepted and respected as we are with the patient most of the time. You know, we kind of know, we have our own ideas and about what is going on. Here I think we are more heard and or listened to, and we are given more respect, and our opinions are also considered when they make a decision about the patient. I'm working in the ICU for the last 7 years. Actually, I came directly from India, so when I came over, I had a lot of questions in my mind. How would it be, you know, how would be the experience and people and everything? But I should say I was welcomed and accepted wholeheartedly by everybody, all the staff, managers and everybody.
If you're coming from abroad, the environment that you're coming to is a very welcoming environment. It's a very friendly environment. We have over 700 staff working here, from a variety of different backgrounds, different cultures, different countries. It is a very unique environment as well, in that it's a very modern, high-tech hospital.
Blackrock Clinic is a large acute facility. However, it's still of a size where it's possible to know most people who work in the hospital. There's great international workforce here. We're located in a very nice part of Dublin, close to the sea, close to the train lines. Access to the city is very easy. So for young people, it's a very dynamic city, and Blackrock Clinic is a very dynamic hospital.
It's very beautiful, and Everything is kind of handy and nearby, so it is a very nice location, and it is very safe. You feel very safe around.
As an employee in Blackrock Clinic, your first 6 months are probably the most important, because that's when we do our orientation with you, and it's a chance for you to settle in here and to get to know us and for us to get to know you. We have a local orientation in every area, in the wards, in every department. We also have a very structured hospital orientation where we do an introduction to the organisation, to the hospital, where you get to meet the CEO, the head of every area. We try to give you an understanding of our vision and our culture and our values, which are very important to us. Our vision is clinical excellence and personal care, and you will see that throughout the hospital, I hope, in every day that we work here.
And it's a very good, friendly atmosphere to work with, yeah, the 7 years have enriched me personally and professionally.
Yeah, I'd highly recommend anybody to work in Blackrock Clinic, especially the intensive care unit. You know, if you want an environment, you know, that's supportive and just a friendly working environment, then I think it's definitely the place to come to.